idiot. It's about time you learned what a liposome is and what the heck's going on. So the statement I've made, and I stand by it, is that for an acute viral syndrome, not other diseases, not bacteria, not fungi, not treponines, not anything else, not for chronic hepatitis, not for cancer, but for an acute viral syndrome, I have repeatedly witnessed a properly encapsulated liposome preparation being significantly more effective than an equal dose of vitamin C given intravenously. Okay? Because what happens with a properly liposome encapsulated product is it's in liposomes that are 100 to 150 nanometers in diameter, maybe as much as 200. Now, we all hear about hepatic first pass metabolism. That doesn't apply here because it's a fat. So what happens is it doesn't go into the portal circulation, it gets immediately taken up by the lacteals, and it goes directly into the lymphatic circulation after you take it, and what's in the lymphatic circulation are tons and tons of immune cells. So it then supercharges vitamin C in the monocytes and the lymphocytes, and what doesn't get immediately absorbed then goes out through the thoracic duct and directly into the bloodstream, where it can then be distributed and go directly into cells. And what's unique about the intracellular delivery is it's not energy consuming. The liposome either merges with the cell membrane or it passes through pores that are large enough to allow it to enter. Bottom line being is you don't need energy consumed to get an energy delivering substance inside the cell. And when you take vitamin C intravenously, and I'm not here to undermine vitamin C intravenously, you know that. What happens when you take it intravenously is reduced active vitamin C still needs an active transport mechanism to get it inside the cell. So you got to consume energy to get energy there. The dehydroascorbate that you get with an intravenous will pass directly into the cell without consuming energy, but for it to be active, it's got to be reduced again. So even when you're getting a large amount intravenously, you've got these energy-consuming mechanisms you have to deal with. So that's the statement. I find liposome encapsulated C, certainly on a dose-for-dose basis, more effective than intravenous for an acute viral syndrome. But as we're going to talk about the multi-C protocol,
BC syringe contain 7.5 vitamin C and magnesium. How many magnesium contain EC syringe?
1 cc of magnesium sulfate, which is 500 milligrams.
Okay.
And 5 cc's of sodium bicarbonate.
8.5%.
And the rest is sterile water.
Sterile water. Okay. The infusion speed may be
usually under 10 minutes.
10 minutes. EC syringe.
Right. We're doing them a little faster today so we can get through with everyone. But for a patient, 10 minutes or less. Really? Yeah.
You mean 10 minutes is 2 syringe or 1 syringe? 2 syringe. EC syringe means 5 minutes. Maybe. Okay.
You want to do it relatively fast so you get that plasma level up. Okay. Don't want to force it because you don't want to blow the vein, but just a steady push.
Steady push, slowly. I have a clinic in Seoul. I treat cancer patients and regularly about 80 to 100 grams vitamin C. Can I use this method to our cancer patient with butterfly infusion, 8 grams?
We like the other intercath needles better for an infusion that takes that long, yes. I mean, you can. We were doing that until a few weeks ago. We just recently changed.
getting from one doctor's appointment to the next.
Wow.
You also have to go through the logistics and then like.
But you know, if they have to get up and go to the bathroom during the treatment, then there's less chance of the intercalf infiltrating the fluid.
Can we use this butterfly method into the chemopot? Chemopot, intracentral venous.
In the port?
Oh.
No.
No.
You use there's a special needle for a port.
Okay, special needle. Okay.
Yes, it's called a Huber needle.
Okay,
Huber.
Huber needle. Okay. Wow. Wow.
That's one. Some people get a little warm feeling from the magnesium if it goes real fast. So you let me know if you get anything uncomfortable like that. Some people feel it in their face. Some people feel it for their
palpitation, vaginal indigestion.
It's just a real warm, hot feeling.
Then the important thing is assurance. There is no matter, no side effect.
Right.
To someone who is symptomatic of hypoglycemia, so I don't think they quite got the whole gist of how the hypoglycemia can actually potentiate.
This cup is normal cup. When you check blood pressure, the same cup.
Same thing.
Yeah, and you don't give them insulin if they're already
We usually take their blood pressure before we start the IV and then just leave it on.
Or you infuse the vitamin C rapidly enough so that the body
How about this bone?
and your pancreas.
That's quite something. I've not
This
seen
is
that.
self-camera magic bone.
Increase cell permeability, okay, and to increase the size of the pores and the membranes of the cells. It also has a specific receptor, and that's
So I'm going to go back to Korea on the camera.
A receptor is actually a molecule that pretty much lays right across the cell membrane. And these receptors are used to channel different things into the cell. And in the case of the glucose receptor, glucose competes with vitamin C for the same transporter. So when you have the insulin, you have more transporters, you have insulin facilitated intake of whatever glucose is present and whatever vitamin C is present.
Nice to meet you, sir.
So the idea of you're not so much striving for hypoglycemia per se as you're striving for the effect of the insulin, and the hypoglycemia is what accompanies it. Although, and we're going to be addressing this in some research down the
How many
road.
vitamins can infused by this method, by
Whether it's
butterfly?
primarily the
Oh,
insulin that's
well,
causing this,
I mean, you
or
can
whether
do
it's
any
the
amount,
hypoglycemic
butterfly.
per se that's causing
If
it,
you
or it's
keep
a
the
combination
late.
of the two.
Yeah.
There's evidence in
Just
the
the
literature.
longer that you leave it in, the more chance you have that it will infiltrate as the patient moves or something.
Something like
Makes your blood
The thing is, the butterfly needles are a lot less expensive than the intercalfs. A lot less.
and or increases the oxygen content in the veins substantially, temporarily to almost arterial levels. So those things could have a lot of impact and need to be interpreted in the context of these other treatments. So, okay.